Start by washing your hands, greeting the patient, gain consent for the procedure, ensuring a chaperone is present, and expose the patient ideally with trousers or skirt off. You may also check the patient's shoes for the pattern of wear. First, ask the patient to walk away a few steps, turn around and come back. You may then assess the muscles and tendons, such as the plantar flexors, by asking the patient to walk on their tiptoes. Assess the dorsiflexors by asking the patient to walk on their heels. Assess the inverters by asking the patient to stand on the outside edges of their feet, and the everters by asking them to stand on the inside edges of their feet. With the patient standing, look at the 3 foot arches, and then look at the ankle and foot, first with the patient standing and then with the patient sitting in a chair. Look for scars, swelling, symmetry, deformity, erythema, sinus, or wasting. Establish if the patient is in any pain, and then also look between the toes. And then check the plantar surface of the foot and the heel for corns, callosities, and ulcers. Feel for temperature changes with the back of your hand. Then feel for pain. Palpate each joint of the foot individually, including the interphalangeal joints, the metatarsophalangeal joints, the mid-tarsal joints, the subtalar joints, and then assess for malleolar tenderness. Palpate the tendons in the soft tissues for evidence of tenosynovitis, including the Achilles tendon, the peroneal tendons behind the lateral malleoli, the foot dorsiflexors, the medial and lateral foot ligaments, and the plantar fascia. Then check capillary refill, which should normally be 2 to 3 seconds. Examine movement at the ankle joint by grasping the lower leg with your left hand and holding the heel with your right hand. Assess dorsiflexion and plantar flexion. Test the subtalar joint by grasping the lower leg with your left hand and hold the heel with your right hand, assessing inversion and eversion. Assess the mid-tarsal joint by grasping the heel with your left hand and holding the midfoot with your right hand, assessing inversion and eversion. Examine the toes by asking the patient to curl and straighten their toes. And examine the hallux by testing flexion and extension of the hallux individually against resistance. You may then move on to special tests, such as Tinel's tarsal tunnel test, percussing the posterior tibial nerve behind the medial malleolus as it runs through the tarsal tunnel. Next, perform Thompson's test by positioning the patient prone with their feet off the edge of the couch. squeezing the calf should cause plantar flexion of the ankle. If not, this is pathognomonic of ruptured Achilles tendon. Finally, complete your examination by examining lymphadenopathy, examining the knee joint, checking distal neurovascular status, inquiring about quality of life impingement and sleep, helping the patient dress, thanking them, and examining radiographs.